So Maxigesic now has a pretty big profile. Tell us about why you invented Maxigesic. But you did invent it, didn't you?
Yeah, no, correct. Look, when we first did it, most of the combination analgesics were essentially codeine and another ingredient. Now, I've personally never thought codeine was a particularly suitable analgesic because it has a lot of problems with it. It causes nausea and vomiting, causes effects on driving, so it can impact your ability to drive. Also causes drug addiction as well, which really doesn't make it a very suitable drug at all. And in fact, adding codeine to other analgesics doesn't even improve the analgesia much. So that's what we were looking to do, was to use other ingredients to make a more effective analgesic that wouldn't have the problems that codeine has.
Do you think that codeine's an old technology? I mean, is it?
Yeah, look, it's certainly an old sort of molecule, and really I think nowadays with these newer analgesics, they are more effective. They have less problems with side effects, less risks from drug addiction. So yeah, I think codeine's a product that it's really kind of had its day.
And the interesting thing is, when you started out with wanting a codeine-free product, but the clinical trial work showed that your new combination actually produced a more effective product.
Yeah, look, that was something that we were pleasantly surprised about. I mean, typically if you add codeine to another analgesic, the pain scores are about 4 or 5% less. So you do get a little bit of extra efficacy. However, the studies that we did with Maxigesic, when we added the two ingredients together, our pain scores were dropping by around about 33 to 35%. So really miles better than the sort of drops that you see with codeine.
Do you think that most people think that you need to have codeine in it for it to be truly effective, you know, to give it the really good bang from a pain relief point of view?
Yeah, look, I think in the past there probably has been that almost misconception, and in fact if you look at the doses that they have in over-the-counter codeine products, they're actually much lower than the amounts that are actually studied and used. So typically they're half or less. And codeine at those sort of doses really doesn't work very well.
Do you think people understand the risks about codeine? I mean, if you stop people on the street and said, what is codeine, do you think they'd even understand its history and its risk of dependence?
Yeah, look, I think that the health professionals are starting to understand it much better now, but I think it's fair to say the man on the street, a woman on the street probably doesn't. In fact, most people would be very surprised if you told them that codeine is metabolized to morphine, and everyone knows morphine is like heroin, comes from poppies and stuff. I think people would be surprised. They wouldn't really think that, but that is the case.
So it seems to me actually that taking codeine out of an analgesic is a good example of the way that you guys do things differently. You look at a problem differently and provide a different solution, and one that actually works better.
Yeah, look, I mean, the combination that we chose did exist, and the doctors tended to write paracetamol and ibuprofen, and that was quite well known. That was a problem though, in that it's very hard to take multiple tablets at different times to remember what you're taking. The other thing that we found too was the exact ratio, the exact ingredients was actually very important, because when you get them slightly wrong, then adding the two together doesn't work any better, and when you get them right, you get a strong additive or synergistic effect. So by synergism, I mean that it's the same as 1 + 1 = 3. So when you get true synergy, you get an extra additive effect.
How come you guys came up with this blend, the ratio that you're talking about? Why not somebody else?
Yeah, look, I think maybe there was an element of luck in it, but the thing is we definitely had a process. We did look at a couple of ratios and we did some research in it, and yeah, so it's something that we carefully looked into.
So you've just done some clinical trial work around Maxigesic, and I think those trials were done in the US and New Zealand.
Yeah, correct.
Can you tell us about those?
Yeah, look, that was a study. We did 408 patients, so it was a large study. It was after wisdom teeth extraction, which is pretty painful, so a very good model to see if an analgesic works. That was a study for registration with the US FDA. Look, we got really good results, very effective, actually surprisingly effective. The response rate was very high for Maxigesic comparison with the other components. The amount of rescue medication people had to use, and most of these studies, if you have pain that isn't addressed properly. You're allowed to take rescue medication, but the rescue medication was very minimal in the Maxigesic group. So really right across the board, from pain relief to speed of action, onset of action, amount of rescue, the response, all the results are very, very positive for Maxigesic.
Because pharmaceutical companies obviously make claims about their products, but it's those clinical trials really that are the proof in the pudding, aren't they?
Yeah, no, that's true. So that's pretty important. If you say something, it has to have some proof behind it. So you can't just make something up and then say it. So basically, for Maxigesic, our prime sort of claims really is faster, better. And the reason for that is because we've done clinical studies to show it works better than ibuprofen or better than paracetamol. And those are the world's most common analgesics. So we've shown that, and then as well we've done other studies that show that it works faster as well. So if you've got a headache or a sore tooth or something like that, you effectively want it to go away better, so you want the pain relief to be better, then you also want it to work quickly. So those are, with any painkiller, those are really the two key points.
And those trial results, of which there have been a number of trials done, are showing both those points pretty clearly, aren't they?
Correct, correct.